Hello, this is Dr. Do again. This video is still on alphabetic list problems, still on letter N. Today I'm going to talk about a presentation. It could be very minor, or could be very serious. It's nausea. It's so common. We all have those moments here or there, feel nauseated. Probably I'm going to talk about this. Start from different ages and what are the common causes, especially for the severe pathological conditions cause this nausea. So let me start from the emergency situation associated with this nausea. What kind of nauseation you need to visit the emergency room? Start from young infant, the newborn. The newborn, if they do not have the sensation of the nausea, but the vomit. Usually the nauseated is like the thunder before the rain. So the nauseated really followed by the vomiting. So talk about the vomiting, then the newborn. The newborn after feeding, the projectile vomiting. That probably could be the serious problem, either the pyloric atresia, which is not opened passage from stomach to intestine. That is, sometimes there are some genetic causes or during the embryo development. So if that's the case, that's definitely the emergency. I'm sure this usually picked up when you're still in the hospital feeding the infant, the newborn. And the meningitis is another series. I'm not saying common, but the series. If your infant, the newborn or infant, have this vomiting, they do not say nausea. They do not know what a nausea is, but the vomiting, projectile, and also lack of activities, feel sluggish, and especially very young, lost the strength of sucking milk, and quieter than usual, and especially some of the kids or infant may have changing color of the skin to the bluish. So these are all the signs. Or older child also may have this kind of signs, feel fever and vomiting and lack of energy, very tired. So regardless, may or may not be the meningitis or could be serious problem. So bring to the emergency room. I'm going to explain why, and also for the young people or young adult, the nauseated associated with this projectile vomiting is also probably the meningitis with the natural stiffness and feel altered mental status, especially for young people just had in the crowded area, or some serious flu or virus can cause this brain problem, cause the serious nauseated vomiting. I'm not talking about the common, but just the severity, what kind of nauseation or nauseated vomiting need to go to the emergency room. For older people, there are a variety of this serious problem associated with this nauseation. The liver disease, the toxicity, and the renal disease, or hypertension, or stroke. So any of those might start with just or heart attack, just start with feel nauseated. So having said that, for these older people, particularly you have the past medical history, do not ignore this simple, sounds like a simple problem, nauseated. If it doesn't go away, if just associated with other symptoms, call your physician to get it clear. It could be just a simple stomach flu, but as a medical field, as a physician, always prioritize with the most serious condition to really jeopardize patients' in life or well-being. So if that's the case, still talk to your physician, or if your physician is not available, go to emergency. And on top of that, follow your own the sense from your gut. What it could be if you have those chronic disease, suddenly develop this weird nauseation, restless. Don't hesitate. Just call your physician or visit emergency room. Okay, so having brought this, the first priority, life-threatening or serious conditions associated with this nausea. And is there any nauseation you can manage at home? Probably you did it all the time, many times, not all the time. Just from lack of sleep, dehydration for young people, or stomach flu. So it happens all the time. You may manage at home, but still there's, however, if the nauseation associated with the serious vomiting cannot maintain fluid, cannot maintain food, lasts for a long time, or especially you have other medical conditions, or the children, this vomiting, nauseating, vomiting lasts a longer time, cannot hold any fluid, call your physician to check it out and to diagnose or to replenish fluid. That's one of the most consequences for the electrolyte imbalance if the nauseated followed by the vomiting lasts a long time. So let me just talk about this two ends of serious problem and manage at home. Let's just talk about the young age children. What are the common cause for this nauseation? Children do not hide themselves. So if they feel nauseated, vomiting, it means there's something going on. So not like so if that's the case, the parent really, I think, need to check it out. Check your child. First of all, check the temperature and check the food, and if you want to, you can, especially for probably beyond 5 years old, you have this kind of nausea, vomiting, you can use some over-the-counter medication. But for younger children, like younger than 5 years old, even though you know it's probably stomach flu, but still, talk to your physician to make sure it is fine. Because for these younger children, if keep vomiting, then the electrolyte balance is hard to correct if not chose a proper time to treat properly, or in terms of time and the whole course. So that's the take-home message. And for the young adult, like I said, many causes, just the stress or party or alcohol, for example, can cause this vomiting, nauseation. You follow your gut. If it is serious, if it's beyond that, then you go see your physician, talk about it to get treated. And for older people, I think the nauseation associated with this healthy older people, I think dehydration probably one of the most common cause for elderly, healthy elderly, and not to pay attention to fluid intake, just busy in mind, or busy really activity, or just somehow, and that causes this nauseation. Try a little fluid. If it doesn't correct, and still I recommend to see your physician, because the urinary tract infection or many diseases can start with this nauseation. Of course, for those older people with systemic disease, I already mentioned many causes of this nauseation. It seems so simple, seems it could be minor, like just lack of sleep, or too serious, the brain, the heart. So the taking home message is this: for young children or the older people with systemic diseases, if you have this weird feeling of nauseation, may or may not have vomiting, and then see your physician or go to emergency room. By the way, for the young children, they do not feel nauseated, but if you see them gagging frequently, so that's the sign of nauseation, and probably with or without vomiting. So then just talk to your physician, to the pediatrician, to check it out. So I'm going to stop here. Actually, the video longer than I expected, because it's so common, covered a variety of the causes. So I'm going to stop here, and I hope it helps. And thank you for watching. I will see you next time.